Welcome back to Alabama Live. It's time now for our Ask the Doctor segment. Our phone lines are open. Give us a call. The number is 420-9732 to get your medical questions answered by Dr. Brian Sellers. Dr. Sellers, thank you so much for joining us. As always, we remind our viewers you're a vascular surgeon. So what kind of patients do you see at your office?
Sure. We see general vascular patients, so peripheral arterial disease, which is plaque buildup or blockage in the legs, is a very common thing that we deal with. Lower extremity ulcers, wounds that are not healing well. We deal with carotid artery blockages, which can put you at higher risk for a stroke. We do dialysis access work. We also treat varicose veins and aortic aneurysms.
You mentioned PAD. A lot of people, when they get older, the veins, their legs, they start to look different. How do we know if it's something more serious, if it's a disease, if it's something that we need to seek treatment for?
Sure. Great question. So a lot of people will chalk up those lower extremity symptoms where the legs get tired when they walk, or they just don't quite have the stamina when they're walking. They'll kind of chalk it up to old age or being out of shape. But in reality, it could be symptoms of plaque buildup in the legs or peripheral arterial disease. As long as it's just, that you can't walk as far as you used to be able to, that's still relatively mild. But as the disease progresses, it can get to where you have lifestyle limiting symptoms. You can also have rest pain, ulcers, gangrene, and ultimately lose your leg. And one of the big things about peripheral arterial disease, it's often a marker for your mortality rate or your overall lifespan, which is not talked about very often, but peripheral arterial disease is a significant marker for your mortality rate. And it's something that needs to be diagnosed early, needs to be treated appropriately, and needs to be taken care of.
We have a caller on the line from Troy. If you can hear us, what's your question?
Yes, I fell, doctor, and on my shoulder, and my arm still swell and then go down. What do you think that could be?
So what happened to your arm?
I fell on it, and it swells up on me and then go back down sometimes.
Sure. When you fell on it, did you go see a doctor about it?
Oh, yes, they did. They did an ultrasound, and they told me they couldn't find it. They thought it was a blood clot, but it wasn't. Sure. So it swells on me, then it goes back down and be numb real bad.
Yeah. So that was my first thought. If you're having swelling after trauma, would be to make sure there's not a blood clot. If they did that and there's not a clot, then it may just be residual inflammation from the fall, from the trauma from the fall. And typically those kind of things usually get better with elevation and rest, and they kind of get worse the more you use the arm. If your symptoms don't continue to improve, then you need to go back and follow back up with your doctor and let them look for other causes. Okay?
And we have another caller on the line, Robert from Montgomery. Robert, what's your question?
Good morning. I have a problem with my leg swelling and restless leg syndrome, and I have factor V, which is it puts me more susceptible to blood clotting. How is that considered?
Right.
How is that taken into consideration?
Yeah, so factor V deficiency can put you at risk for blood clot formation for sure. Really depends on how many copies of the gene you have. So for factor V Leiden deficiency, you can have people who have one copy of the gene who are at lower risk for blood clots. People who have two copies of the gene are at much higher risk for blood clots. So it really, as far as the treatment for that, would depend on which one of those you have. Obviously, if you have two copies of the gene, most people are on blood thinners preventatively for that. Swelling in your legs with that deficiency could be related to previous clots that you've had, or, in general, the laundry list of things that can cause leg swelling is pretty vast. So just leg swelling in general, take the factor V deficiency away from it. It can be medication related. It can be due to your heart. It can be due to your kidneys. It can be related to your veins. So leg swelling in and of itself is a pretty complex thing to work through. Without knowing more about your leg swelling and how long that's been going on and more specific things, will be hard to tell you exactly what's causing it. But in general, leg swelling is treated, the same way. It does tend to improve with leg elevation, compression pumps, activity modification, diet, exercise, weight loss, all tend to make leg swelling better. And if you can pin down what the underlying cause is, whether it's cardiac or renal or venous or something else, it gives you an opportunity to try to make it better by addressing the underlying causes.
Robert.
Sorry that was so long-winded.
Robert, thanks so much for calling in, and keep those phone calls coming. We'll have more from Dr. Sellers in just a few minutes. But first, we're going to take a check on our weather.